Hello, I'm Dr. Maria Sulindro. Hi, Dr. Audrey. I was just wondering if the internet is working. Okay, I'm Dr. Maria Sulindro, integrative, specialized in integrative anti-aging medicine, practicing in Pasadena, California. Today, I have special guest, returning guest speaker, is Dr. Audrey Kohar. So let me introduce you before I introduce the topic today, which is very, very interesting. Does hand dominance make a difference? So Dr. Audrey Kohar graduated as a doctor of osteopathics from Western University in 2014. Completed her residency program at the University of California in Irvine in 2018. Practicing as a rehab consultant at the Little Company of Mary in Torrance and Long Beach Memorial Hospital. So, hi, Dr. Audrey.
Hi, good afternoon.
Good afternoon. Thank you for taking your time to discuss this does hand dominance make a difference? Because occasionally we as a physical medicine and rehab specialist or trained as one, we have to decide whether we can help the patients to determine their dominancy in adult. But we're not just going to discuss about that, but we are going to tell you what is it and does it make any difference, right? So the first question I have, Dr. Audrey, what is handedness or hand dominant? What is it meant by lefty or left-handed and righty or right-handed? Can you please share with us?
Sure.
Thank you.
Left-handedness, right-handedness, hand dominance, it's really just a complex trait that scientists think could be genetically derived, like with some weak genes that we have in us as humans. And it's also influenced by multiple environmental or cultural factors. I think in the 1990s, it was quite popular in the 90s, and there was a lot of talk about religion and how social stigmas can affect hand dominancy. Hand dominancy is the tendency basically to be more skilled and comfortable using one hand instead of the other hand for tasks that are important to us as human beings, such as writing or throwing a ball. We know very little about its biological basis, like how it occurs, why some people are right-handed, why some people are left or both. But we know that, or scientists think that development begins a little bit before birth. So there's a prenatal environment for the development of dominancy. They think there's some studies that hint at the way the fetus sucks their thumb in the womb of the mother can kind of predispose you to one dominancy over the other, whether it's left, right, or both. And we know this one. We know that babies start grasping their hand at 6 months because they start to sit up and they start to grab things at 6 months. But we know when we study child development that at 2 years, or at the very earliest, maybe a year to 2 years, that's when you start to see them taking a preference over one particular side. I think sometimes people ask, like, why is this important, right? We now kind of start to see a correlation of language ability and right hand dominance. So if you're a righty, there's some correlation to language because both things are controlled by the left side of the brain. Your language is controlled by the left side. If you're a righty, you have left brain dominance. We'll talk a little bit about that later. And I think a lot of scientists get very excited and interested about this topic because starting in like the late 90s, they also started to talk about, the scientists start to see some correlation or pattern that, left hand can relate to some mental health or some psychological concerns. And that's where people started talking more and more about it. But today, we are still under a lot of debate. We don't really know much, bottom line.
That's it. I wish, because I write with right hand and I don't even have any skill in language. Try to, as a Chinese descent, I would like to speak or be able to speak Chinese at least, right? But it's so difficult. Anyway, thank you for explaining what is lefty and right-handed. Now, left-hander is very interesting, right? Because the majority of us in the world is right hand. But left-handers have excelled in all walks of life, it seems like, but more likely also to be genius. Now, is it a myth? And I hope so, because then otherwise the right hand person would be very jealous, right? But these are example of left-handed people. Leonardo da Vinci, Mark Twain, Mozart, the musician, Marie Curie, Nikola Tesla. We all know who Nikola Tesla, right? And then Aristotle. They include also 5 of the past 7 US presidents: Bill Gates, footballer Lionel Messi. Einstein was actually not left-handed. Just believe me, because they found out that he was symmetrical, means could be ambidextrous, right? So, yeah, it's okay. So I'll share with you some typical pictures that you will see if you Google. And okay, just one moment. Are you going to do this, or is on at my end here? Let me see.
I can do it. I have it up here.
Okay.
Okay, so I'm going to share the screen.
There you go. Okay, so open a little bit. I'm not sure my, so let me see, choose video.
There you go.
There you go. Okay, do I have a ability to do pointing this? Let me see. Okay, yeah. Okay, so if you see on the top left corner, okay, those are presidents that are right-handed. And then you see you have a tendency to see who is left-handed, who is right-handed, because from the picture there when they touch the Bible, and if you look at President Bush, he is left-handed. And the next page, the next picture here.
Oh, next picture is this one?
Yes, these are the 3 presidents that are left-handed. And President Ronald Reagan, President Barack Obama, and Bill Clinton. These 3, I think these 3 presidents, they all had 2 terms. So it's very impressive, isn't it? And then look at how these presidents sign, and then these both sign with the left hand. So, left hand is not like... Okay, Dr. Audrey, I'm so sorry. I don't know what happened, but it's an internet connection problem. I think we finished with the picture of those presidents. That was the last time. Did you see that one?
Yeah.
So we had the left-handed president. So I think the 20th president, President Garfield, 31st President Hoover, President Truman, President Gerald Ford, and then President Ronald Reagan, 2-term, George Bush, 2-term, President Clinton, 2-term, and Barack Obama, 2-term. Okay, so those are example of lefty that achieve very well in this world. So I was just thinking about, what if someone uses both hands equally well? Okay, so you want to come in with this information? This is those. Go ahead.
Yeah, so when I read more about it, we know statistics give us that we have a lot of right-handed people. 90% of the global population, we're right-handed. I'm right-handed. 9 to 10% are left-handed, so the rest of the world, and less than 1% are ambidextrous. So ambidextrous is basically the term that people use to describe someone who can use both hands, right and left, for fine motor skills equally well.
It's common to find people who may not start out as ambidextrous, even though they're adults, but then grow to learn how to be ambidextrous. So you can develop it as a skill. A lot of jobs require that. So certain jobs like music, so drummers need to be ambidextrous, science, surgeons need to be ambidextrous, and some athletes need to be ambidextrous too. So there's not much that we know about it, but I think where the right hand and left hand comes from is, like I mentioned before, if you're right-handed, your left brain is dominant. The brain is made up of two parts, and we'll kind of talk about that in a bit. I think Dr. Mary will talk about that later. But basically, if you're right hand dominant, that makes your left brain dominant. It's a cross path. And then if you're a lefty, your right brain is dominant. And this is really why people think it's interesting, is because this is really being a lefty or a righty. When we have lefties and righties in the world, this is one of the most obvious reflections of how we have brain lateralization. That's the term, which is where you have two different parts of the brain and they have different functions, but they work together. And I think, Dr. Maria, you were going to kind of teach us a little bit more on that.
Oh, okay. Well, I always wonder for a while in the past that if I am actually in the right field right now, which is science, right? Very important though for scientists to excel. I thought maybe I'm not excelling because I was supposed to be left-handed. So maybe I cannot speak the Mandarin because I'm supposed to be left-handed or something like that. So anyway, but I do believe that I have interest in art and I appreciate art. So that's also another reason why I thought maybe I was supposed to be left-handed. Now, why I said that, because culturally, like Dr. Audrey had already mentioned in the first question that I asked her, that this is influenced by environment and then by the job and by culture. Yeah. When I was growing up, when I was young, we were not allowed to receive anything with our left hand. We were not allowed to shake hand with our left hand. We cannot thank people or say goodbye with the left hand, because the left hand is considered like not a good hand. That's why this is called right hand. Now, I read somewhere in the past in French word, left means bad, like evil, right? So it's this is very interesting to me, because I think when you see later on, when Dr. Audrey also said that, baby was born with the whatever hand dominant is, it is true. And we should allow the brain to grow as its highest potential. So for example, a football player, we have a picture here. You want to help me show the picture there? And also I will explain about the right hand and left hand. Okay, so the football player is which one? Is this one? Yeah. Okay, yeah, there you go. You can see in football, if you are good in avoiding and running away from your opponent, if this guy is right-handed, and then he has to be able to hold very well the left ball and protect it from the opponent. So this is how they have to train themselves also. The left hand, they train the right hand, the right hemisphere. Right hand, they train the left hemisphere. But if you grow up with right-handed, so automatically the muscles, the dexterity, or the proprioceptive, this one is proprioceptive, everything grows dominant on the right side, also the right leg. So this is, I just want you to give an example of people who have to train themselves to be so-called ambidextrous, but they not necessarily know how to write with the left non-dominant hands. But in their job and in, for example, someone who hammer a nail, they have to hold the nail with the left hand, but they're right-handed, and then they hammer with the right hand, which is the major hand or dominant hand. But the left hand, it still has to be very secure handling the nail, otherwise they'll just injured themselves. Okay, thank you for sharing the picture. And since we are trying to do this, and I tried Dr. Audrey to help me because she has all the pictures, and then she can do it easier. And for the right brain and the left brain, did I explain? Maybe not. But the right brain basically better in recognizing faces, emotion, geometrical patterns, and better in analyzing other sounds like music. Well, I lost my list here. Just one moment. Okay, so there you go. See, this is the left brain and the right brain. So I was talking about the left brain. Wait a second. Okay. So there you go. Thank you. So the left brain person, which is on the right here, okay, and then this one, they are good in science and in math, and now I recognize that science and math is right-handed here, but again, science is part of an art actually. Science is, to me, science is an art. When it comes to math, something like that, then it's very solid, right? It's definitely you're right-handed. So I don't want to be ambidextrous because the more you read about it, the more I think we prefer to be like just one side. It's better. And then on the left-handed, which is the right brain, they're very good in recognizing and imagination with abstracts, and very good in feeling. They're very more emotional than the right hand, which more practical basically on the right hand, and they are more logical. Okay, thank you so much for sharing this one.
Okay.
And in the middle, you can see that is a bridge called corpus callosum. That's why you actually gain both hemispheres if you train to be both hemispheres strong. But again, because we have to write all the time, I think people just recognize when they say, are you right-handed? That means, do you write with your right hand? Okay, thank you so much.
Okay. Stop sharing.
Stop sharing. And then we are going to talk about maybe stroke, right? So I think Audrey will share also again here with if there is a stroke, and because she is in an acute rehab setup, so she's dealing more with stroke. Majority of rehab patients in the acute rehab hospital are stroke patients. So if there is a stroke, Dr. Audrey, and then there is a hemisphere or paralysis of one side, for example, the right side, half of the body paralyzed, can there be a chance of dominancy here? Because let's say if the person is right-handed and now the right side is paralyzed.
So the quick answer to that question is that there's not really a physiological change in dominancy. It doesn't mean that, okay, you are right-handed and you get a stroke and it knocks out your right side. It doesn't mean that, oh, there's a change to suddenly you become left-handed dominant. It doesn't work that way. But like I talked about previously, dominancy or of the hand can be trained. It can be developed even as an adult. So for people who have strokes that affect one side of their body, the therapy can work to slowly incorporate the other side to compensate and potentially learn how to operate as a normal arm as much as they can, and as much as the patient can progress further. Because even if in people without strokes, you can learn how to use your left hand if you're right-handed. And I mentioned just now, like, like surgeons or drummers, they can do that. Um, I think since we're talking about therapy after stroke, I also wanted to share two main therapy models that have been very extensively researched. A lot of studies support it, and till today, we still use it to help with weak or stroke affected side, talking about the upper extremity. So the first model is the mirror therapy. So essentially what happens is you place a mirror in front of your bad hand. So let's say this hand is bad. I put the mirror in front of my bad hand, and the therapist works with me to move the good hand in the mirror, and I look at the mirror, and the mirror can trick the brain into thinking, oh, my bad hand can also do the same. I'm actually going to play a video. I think it makes more sense. It's probably better than me explaining it. let me tell the video for you.
It's a real test video. Yes, thank you.
But this is mirror therapy. I give credit to Moss Research. I really just YouTubed and I listened to a few, and I think this one is pretty good. Go ahead and play it. Let me share my screen first.
Arm. In mirror therapy, participants practice making movements with both arms, but they only get visual feedback about movements of their good arm. And through repeated practice, this retrains the brain to rewire itself and improve functioning of the impaired arm. The goal of my present research is to test whether mirror therapy can effectively be given at home. We train a large group of stroke survivors to practice mirror therapy at home, and we're looking to see how they improve and how quickly they improve. In this study,
so you notice if I go back here, I'm going to replay the video again for those who miss it, but if you notice, the bad hand is the gentleman's left. So you notice he's kind of slightly moving it because that's what the therapist does. They try to guide you to move it as his good hand is moving on the right side. So bad is left, good is right.
Present research is to test whether mirror therapy can effectively be given at home.
Okay. And the other therapy model, I'm going to stop this for now. The other therapy model is called constraint-induced therapy. And basically, they work with your bad hand. They cover your good hand with a glove, so you're forced not to use it. So this is just, it's not a punishment, it's a therapy model. They force you to keep your good hand on one side. You sign this contract that with the therapist to say that I'm going to be using my bad hand most of the time. And that kind of has been shown, research has been done extensively to show that it actually works to bring back the function of the bad hand. I'm also going to play a video one more time. Let me share the screen here, one moment. Okay. This is also credit to a rehab, Mary Free Bed Rehab Center, who took this video.
Nice. Way to get in there. It's that thumb that's holding you up. There you go. Good. Way to take over. It's the constraint-induced movement therapy. Most of our patients that come here have one hand or limb that is affected and is not being used. So they've learned non-use of that hand. So now what we're trying to do is to teach the brain and reprogram the brain to use the affected hand more effectively. We actually have a mitt that is placed on the non-affected hand, and they sign a behavioral contract stating that they will commit to wearing this 90% of their waking hours, and that will be run for a 2-week period that they come for therapy for 3 hours a day. That's awesome. Work.
My stroke was in the part of the brain that control the high motor skill, and that's a lot of literature says that when you get there, you cannot do this anymore, but you do it if you walk.
There you go. I like how he's so excited that he can use his hand after the therapy. That's great.
Yeah. That's very good, videos, and I hope the listener recognize that as a rehab physician and the therapist, physical therapist, and also occupational therapist. I don't know if she is, but we all have to recognize how to improve the other hemisphere that was non-dominant, so that the person can go back to the closest to the optimal function. Okay, so for example, if when I worked for a workers' compensation evaluation, it's called a qualified medical evaluations doctor, we have to also do I mean, measure the disability, whether the patient has permanent or partial disability. That is very hard because, and I'm pretty sure it changed when the rehab and physical medicine improves in technology and everything. So that all that part of the evaluation changed a lot also. That's the reason why sometimes patient they do not like what we say because they have a previous friends probably that has the similar injury or similar problem and had a better compensation than what they are. We want them to be retrained, but some patients would not recognize that. So we would like, both of us would like to improve the awareness in the community that it is best if you recognize this, so you know and you have hope that you can actually go back to the previous function again. So also as a physical medicine and rehab specialist, we do test one right or left dominant hands with a certain test, and maybe Dr. Audrey, you can give us an example of this test done in the hospital. Oh, yeah, in the hospital, right? So
Yeah, I don't typically do it myself, but I know rehab doctors may do it outside in their clinics. Especially Dr. Maria, you work with a lot of workers' comp in your
that's
clinic,
right. Yeah.
so I'm pretty sure you've used it. But we are talking about the Edinburgh Handedness Inventory. So essentially, it's kind of like a questionnaire. So it's not any sophisticated tool. It's really just a questionnaire where the therapist will get involved or a physician can get involved to ask like 10 to 20 questions in terms of which hand is the patient using when they're doing certain activities. So we're talking about things that we've mentioned before: writing, drawing, using the scissors, brushing your teeth, sweeping the floor. And usually, sometimes people do it themselves, but then it's most accurate to have someone visualize what you're doing. So you don't really get to think about it. You just, whatever comes naturally is what is recorded. And it's also a very common screening tool to use in research also. When people research about hand dominance, you see this come up a lot, Edinburgh, because they use it as a form of data intake. And the final score out of all those questions, there's a formula in the end, and then that formula can tell you whether you're right or left hand dominant. I'm going to quickly share my screen just to show you what the questionnaire looks like. But it's nothing fancy, really. I don't know why the slideshow keeps going backwards, but it looks like this. So this is a very simplified one. It's a very short one with 10 questions, but complicated ones can have 20 questions, and they have the formula right down there. Let me
So
stop.
this is the short form. It's called the short form. I see. Okay.
Short,
is it done by the occupational therapist?
Yes, it's usually done by a therapist, so it's a little bit more accurate, so there's no bias. Yeah. Okay.
Okay. So I thought you were going to read what questions they have. Okay. So I think you just trust the evaluations because most physical therapists and occupational therapists, they have a goal, and we work in a group. It's called rehab team, and we always try to we try to go to the next level of function, which is very encouraging. Now, Dr. Audrey, do you know if will hand dominance change throughout our life?
Yes and no. It really depends. I think we've kind of touched on it briefly previously, but
it's affected, right, by as you grow older, you want to touch that area?
Sure. If we're talking about the elderly population, it may very well change. So what we know is that hand function can start deteriorating in the elderly population. There can be many reasons that result in that. When I see my geriatric patients, there can be structural changes to the hand or pathological conditions. It could be things like stroke or amputations, carpal tunnel, like medical illnesses that can result in a change in hand function. And then in addition to that, in the elderly population, we know that there's brain atrophy. People with dementia have brain atrophy. As you get older, there's also natural, slight changes in neurotransmitter synthesis, changes in the size of the corpus callosum, which is what we talked about earlier, which is the freeway that connects both brains together. And all these changes can be associated with an overall decreased hand coordination. So when we talk about hand function, it's really like hand coordination, because you need coordination in your hands to actually use it properly. So in this case, it forces the brain to create compensatory. It forces the person, the patient, to create compensatory mechanisms over time, because one side's getting weaker. So the adaptable human being can be forced to learn the other side too. And then over time, potentially, hand dominance can change. There's actually studies, and I want to credit my occupational therapist that I spoke to at the hospital today. They study a lot of this too sometimes. And so there are studies recently that they're small studies, like maybe a few patients, but a few of them can reflect that they look at amputees. A lot of amputation occurs, if we're talking about amputation of the upper arm, a lot of amputation occurs because of trauma. So they could be operating machinery and then they get amputated. And so it's usually with the hand that's dominant, because you're using most of the hand and then it gets hurt with the machinery. And so the studies have taken these people and put them in like a 6-week riding program, or like an intensive riding program. And they have shown that these amputees can achieve hand precision in terms of handwriting, very close to the dominant hand, what it was like before. So they're able to train their left hand to write as well as the amputated right hand. That's pretty cool. New up and coming studies coming up. One of those, yeah.
Wow. Yeah, actually, while preparing this talk, I also saw this, I forget the name, but you can Google it. One person is a young boy. He can play piano with 2 hands, but in 2 separate pianos. Have you seen that? Ryan something is his name. So he is in a concert where they have 2 grand pianos, and then he play a music, but 2 hands in 2 different pianos. Amazing. And then I also saw a guy, who is an artist. He can use his two hands to draw one painting on the other one paper, and the other hand on the other paper, 2 different paintings. It's such a strong brain in both sides. Now, I would like to revisit that piano player, because someone asked me before and I forgot to check. Next time I'll show this again. Let's do this again, Dr. Audrey, next time. But since you're in the hospital, can you please tell us about the ADL, the activity of daily living? Because this is probably the most what people wants to know or should know when something happened to them.
So
when people talk about activities of daily living, it's a very general term that we use in the Department of Rehab a lot. And usually it is what it says. So it's talking about activities that you do daily. So 5 big categories are dressing, putting on your shirt and pants, bathing, being able to bathe. You need your coordination of the hands to be able to bathe sufficiently. Transferring, which is moving from maybe the bed to the chair, and maybe from chair to standing up. You need your hands for support too. Yeah, so these are all things that you need your hands for. Toileting is the 4th one, which is wiping your bottom, wiping it clean. You need your hands and coordination to do that. You need good range of motion. You can't just do it if your shoulder is stuck or if your elbow is stuck. You're going to have a lot of problems toileting properly. And the last one is eating. And with all these activities of daily living, we are essentially talking about, when we talk about the hand, we're talking about reaching for things, grasping, moving objects, transporting objects. When we talk about the hand, we're talking about fine motor activities too. So like writing is a fine motor activity. And I think what is the take-home point is that when we have issues, in my case, when we work with patients who have strokes or brain injuries in the hospital, the idea is that we know why hand dominance is important. I'm going to tie it back to hand dominance because we're talking about that today. Why it's important is because the therapist will want to know, like, which one is your dominant hand? Because no matter what happens, if your dominant hand is affected by the stroke, they want to work on that hand. They don't want to give up on that hand, because if you think about it, you get a stroke when you're 50 or 60. If you're unlucky, you get it earlier, maybe your 30s. But you have had all that time, and it's past puberty, to develop neural connections to your dominant hand. Your brain and your nervous system has developed that connection as you played sports when you're younger, as you write throughout life. So your dominant hand has this strong connection, and even if it's affected by the stroke, the therapist will want to look at it and try to salvage whatever they can and keep working on that dominant hand. And they will kind of use your non-dominant hand as a backup, as a reinforcement or compensatory mechanism. If, let's say, your main hand is so much affected and it needs help. So that's what actually happens when we talk about daily activity living and we talk about occupational therapy after stroke.
Thank you. Thank you so much. So I hope that helps. And thank you from one of the listener, Victor. He also experienced when he was in Asia, he knows that the left hand is considered as dirty hands because toilet paper, before the toilet paper was made, you have to wipe your butt with your hand. And they purposely assign the left one and to wipe your butt, and so you have to wash. And even though after you wash your hand, you still have to handle your spoon and your fork and pick up the dishes with your right hand, right, Victor? Thank you so much for that. And also, if you have to give a gift, and then you have to make sure you respect the person by giving it with the right hand. So I'm going to wrap up today. The take-home message is, we know the babies is born with dominant hands. So how do we know? Because during the ultrasound, they show that the baby is sucking using the left or the right hand. So that usually become their dominant hand. In the world, the majority is right hand dominant. What we know why? Because in Asia, that's where all the human beings are. Mostly that's Asia. So in Asia, you can see there are those cultural rules that right hand is the right way to go. So that's why right-handed people are majority. But hopefully, in the near future, they will catch up. The left hand is used as well with a different function though, and capability of being trained as a dominant hand. So 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 the message is, even you are right-handed, you can train your left hand to be the dominant hand if necessary, and depend on how severe is the injury. Like if you are told that the injury, like I had a broken hand, the right dominant hand was broken before, and I couldn't function very well. I still they didn't even train my left hand, or I didn't even think about training my left hand, because I was expecting the right hand to come back in full function. So, and Dr. Audrey said brain changes as we age. So that's the dominancy. And if your brain atrophy, then you have to compensate, and using another hand perhaps to do what you have to do, which is the daily living activities, or ADL. And it's very important also that ADL is after if you have a stroke. Stroke is number 2 cause of death and cause of disability in the world. So you will see a lot of these stroke patients. That's why Dr. Audrey is very busy every day. Okay, so parents should not force any dominancy to their children, and just let the brain will grow maximally if we let them. Anything you want to add, Dr. Audrey? We passed the hours, and with all the internet situation just now, I will allow you to say anything else, and I will close this meeting.
No, I think the summary was very good. Thank you.
Thank you so much for being with us, and I really enjoy the refreshment of having the young rehab specialists in my YouTube. Thank you, and thank you everyone. Don't forget to give the thumbs up to this video for Dr. Audrey Kohar, and thank you for sharing with your friends and family. I'm Dr. Maria Sulindro, integrative anti-aging medicine, practicing in Pasadena, California.